hopefully you can see that an illustration in the text that says love heals. And in many ways, that is who we try to be. We try to be a medical organization that is more than simply medical, but also is compelled by love and empathy and compassion to bring about transformation. And so I'd love to share a little bit about our model so that you can understand the nature of our work, and hopefully that will be useful to you. So the first thing that we do is that we train pediatric surgeons. And so for over 10 years now, and many of you will know the name Dan Panero, who was in town here in Kingston, and he's now a professor at McGill. He's a pediatric surgeon. And when he became involved with Bethany Kids, he shifted the model away from one surgeon from another country providing care to children, and instead training and resourcing pediatric surgeons from the continent of Africa itself. So every year we train new pediatric surgeons. They currently, including our trainees and those who've graduated, represent 10 different countries across the continent, and every year that number grows. And so we're very thankful that we can provide that level of quality surgical fellowships, because many of the countries in which we work, there are very few programs like that. When we started, there was no other pediatric surgical fellowship program in East Africa. And still to this day, many of our surgeons are the only surgeons serving in their home countries, in the 7 countries where we work. So once we train, and these are some examples of some of the surgeons you can see hard at work. Once we train a new surgeon, and that takes, of course, a number of years, they come to us as a general surgeon, and we train them as a pediatric surgeon. And they return to their home country, we begin to face new obstacles that we need to overcome. In many ways, the challenge, you might have heard the term brain drain, something to that effect. And so frequently, these are some very accomplished, extremely talented medical practitioners and surgeons, and they get to their home countries in Uganda, Sierra Leone, elsewhere, and despite being the only pediatric surgeon in some of these countries, the hospitals don't always have the ability to pay them a fair wage. So I can remember I was in a conversation and negotiation with the hospital, and they wanted one of these pediatric surgeons to come to their hospital, and they said, listen, I think we can offer $500 a month. That should cover the cost of an entire pediatric. I mean, you can imagine a pediatric surgeon in Canada does not get $500 a month. It's a different wage. Even within the continent of Africa, that is not a fair wage. So we are fighting to ensure that these hospitals are paying fair wages. And one of the ways that we do that in the short run is that we pay about $30,000 per surgeon to continue to serve and prioritize those children on the margins of their society. Because the alternative is that they would only serve those children who have the most amount of money who can afford to get care. And so by us supporting them by about $25,000 to $30,000 a year, those surgeons are able to take care of children based on need, not based on finance. And so that has become the sort of second wave of our movement, where we train these surgeons and then we begin to support them and resource them. And of course, we hit other obstacles as we do that, because in some of these countries, the cost of care at the hospital, even if the surgeon is free, there's still costs regarding testing or ward space, and sometimes the cost of a couple $100 can be the difference between a family being able to access medical care and not. And so we pay patient bills as frequently as we possibly can. When there's a patient who cannot afford the cost of care in a hospital, we will pay their bills. And over 50% of our costs to this day continues to just be paying for bills of children who otherwise would not have access to medical care. And this is significant when we talk about children, because when a child is sick, the whole family is impacted. But when a child is healed, the whole family can be lifted out of poverty. So by focusing on pediatric surgery, we're not only helping that child, but we're lifting the entire family into a different way, a new life, new opportunity for them. Once we provide that, of course, new lessons learned is good surgery is only as good follow-up care. If you're a medical professional or someone who's experienced surgery yourself, you'll know that you need good nursing, good rehabilitation care, occupational therapists, physiotherapists, the works. You might even need a wheelchair. And so over time, those are some of the other things that Bethany Kids has grown into. We began with strictly surgery, but when you see that a child has received surgery and is not recovering well because they don't have good access to a therapist, then we want to be involved, because we care about children receiving the best possible care. One of the big turning points for us when it came to offering this level of holistic care was we got involved with a school called Joytown School. Joytown School is a joint school between the Salvation Army and the government of Kenya, and it was a school for children living with disabilities. And when we got to this school, the rumor was you could smell it before you could see it, because the condition that these children were forced to live in was awful. Part of the challenge was many of these children had continence management issues. That is to say that on a daily basis, their uniform and their bedding would have been soaked. And they had one woman for every 40 children to care for the laundry services alone, to care for the mental and well-being of these children, 1:40 ratio. And I might add, the laundry is being done by hand. You can imagine that's not a great model. So when we arrived there, we said, we'll take care of the laundry. We built the laundry machines. We hired laundry staff. But we've also brought in about 12 people who are occupational therapists, nurses, physiotherapists to ensure that those children have the best possible follow-up care. Out of that program, we now have wheelchairs being provided to these children. In fact, we now have former students from the Joytown School who work with us on staff and have come out the other end, which is always a joy to see someone who's gone from being a patient to being someone who can now provide care to the next generation of children. So we provide holistic care that transforms lives. And in numerics, we're looking at about 3,000 children receive surgery from us on an annual basis. Some more numbers that might be useful. Again, I mentioned this one. 10 different countries so far have been part of our training program. Some of those people are in training today, and then we have 7 countries where we have begun to support work. That's as far west as Sierra Leone and as far east or south as Madagascar. So right across the country, or the continent of Africa, sorry, we have countries in which we work where we're providing meaningful, compassionate, transformative care. We've provided just over 40,000 surgeries to children since we began our work. 40,000 children. You imagine the families that are involved that can have hope, can have a transformed existence. And finally, we have in more recent years begun to provide appropriate wheelchairs to these children and have done so. The number is about 3,000 chairs to children. That's one example of the holistic care that we offer. I know you as a club have supported our mobile clinics and other resources to ensure that children have access to the hospital and have follow-up care. So all of that work comes under holistic care, but just one number, 3,000 wheelchairs in the last couple of years since about 2017. And not just any wheelchair. I should state that this is a major issue in low and middle income countries, and that is that frequently we dispose of our garbage chairs in someone else's backyard and count it as a gift. If you take my meaning, we frequently will say, well, my grandmother had this old chair. Perhaps this 4-year-old child with an entirely different medical condition could benefit from it. The answer probably is no, they can't. It's probably the wrong chair for a child. So we try to resource and sort the very best chairs for these children that are appropriate to the landscape and also appropriate to the medical condition, so that children who receive care from us also have the best chance of having a wheelchair. And a good wheelchair might only be $600, $700 for some of these children. But when you multiply that by 3,000, and in the last year alone, that number is going to increase dramatically. Those costs, as you can imagine, tend to be raised in places like Kingston and across North America. I wanted to share one story of one person because 3,000 can sound like a big number or a medium-sized number, but it really comes down to people. These are human beings, human lives that we care about. And this is Francesca. She's actually been here to Kingston. She's spoken at events around this city. And so I wanted to tell you her story if you haven't heard it. And one of the reasons I wanted to show her photo and tell her story is because she's now an employee with Bethany Kids. And so we see, again, this full circle. But it didn't start like that. Francesca was born in a community that saw her medical disability as a curse. The community in which she grew up in, the religious, cultural identity was such that because she had spina bifida, she was a cursed child. And the solution to a curse is to get rid of the curse, right? That is that they tried to poison her. Her own family tried to take her life. This is Francesca. When she was a baby, the family looked at her and thought, we have to get rid of her. And she survived. The family took her in, cared for her. But it wasn't easy. Even until her teenage years, I remember her sharing that there was a big wedding, that they were all meant to go. Everyone was meant to go to the wedding for the family, except her. She was left behind because of what she looked like, because of her medical condition. In her case, her spina bifida meant that she couldn't control her bladder, something that could be corrected to some degree in surgery. but she didn't have access to that surgery. And so in her description, she was wet every day until she was a teenager and she came across Bethany Kids. So when we talk about transforming medically, the impact socially and culturally is also substantial. Because if you have a medical condition, your parents might not be able to afford it, care, but even if they can, you're seen as something of an outsider. You are on the margins of society. And so someone like Francesca was seen as someone who couldn't get anything done, who wasn't involved, couldn't even come to family wedding. But her life was radically transformed when she encountered Bethany Kids. Not only was she able to learn skills and complete school and become an incredible part of her own community, but eventually we knew that we had to have Francesca on her staff because she's an incredible leader, an incredible influencer within the community. So she now works at that same school I mentioned at the beginning, Joytown School, and ensures that those children have hope for the future. Those children know that there's potential in their lives that matters, that each and every one of these 3,000 children that we care for on an annual basis matter. And we do everything we possibly can to get the resources in their hand so that they can have a full and fruitful life. And that work, of course, happens because of people like you in this room and on this Zoom call. We are long-term looking to do what we can to find local partnerships in the countries where we work, including Kenya, where we try to raise as much money locally within some of these amazing countries. But right now, we continue to depend on the generosity of communities like this. And so I come to you today, not simply to tell you stories and to share with you the work, but to ask you for support, because we need it. If we are to continue to provide the transformative care that we do, we require the support of donors across North America and across the broader world to partner with folks and remind ourselves that we are human beings, we are equal in value, and a child born on the other side of the world with different circumstances and different opportunities still deserves the very best chance at life.